Filler patients may suffer lymphatic blockage and possibly worse. That's the headline that has come out of the Irish Examiner that then went viral amongst our community. So this week, we need to discuss a little bit about what's actually going on with this research, what you need to know so that your patients feel reassured if you are going to be asked about this topic, and also to reassure yourself that you really are doing something that you believe to be right, because things could change at any moment, and it is important to be consistent with your values no matter what's happening in the world of aesthetics. There's a plastic surgeon who's done this study. His name is Spiro Theodorou.
I believe so.
Yeah, and he has done a study involving injecting some dye and seeing how much the lymphatic drainage was affected. At least that's his hypothesis. I'm still not sure how that really plays out because we'll talk more about it as we go in, but I'm not convinced that that experiment is going to answer the question, are the lymphatic drainage channels blocked? It just tells you the dye did not leave the filler, which is not quite the same thing. So, but he's then inferred from that there may be some more global effect on the immune system, which is a big leap. And then in the same article, they chuck in some reference to delayed onset nodules, which are also not actually connected with either of these things directly. So there's a lot of kind of, to the untrained eye, scary statements that are leading to people worrying and freaking out, which means you get lots of clicks and people share the article and everyone comes to your website and then you get paid more by advertisers. And it's always just worth remembering that that's why these things are in our faces. The more you develop in your career, the more you'll realize the stuff you read about has some sort of commercial driver behind it. And that's fine. We all have to make a living, but just interpret it that way.
Can we go on to the statement then where he's put... Under eye filler is one of the biggest problems. You see women everywhere with swollen eyes. We have young women having fillers in their faces. It's never going to go away. It's very hard to remove and it blocks lymphatics in your face. This is a very important system. Not all patients will have swelling, but evidence suggests all will have some degree of lymphatic blockage. Can we just dive into that a little bit? And why is he saying that he's just relating this to under eye filler?
So under eye filler is the most easy to see if you have excess, because basically the skin is only 0.2 millimeters thick. So if you inject a little bit or a little bit too much, or maybe the filler breaks down slowly and it attracts more moisture to the area, or maybe if there is a blockage to the lymphatics, which I'm still not absolutely sure that that's what's happening, then you're going to see a protrudence, which is very easy to see. So it's not hard to get rid of. It goes away very quickly with hyaluronidase, so you can dissolve it.
He has said, so he's made a kind of argument there that you can get rid of it with hyaluronidase, but a complete removal poses a significant challenge. So as a patient, my question would be, all right, what's the big deal then if it just hangs around in my face a little bit longer?
The main thing is this a collection of molecules like collagen is in your skin? So collagen's in your skin, it doesn't get drained out through your lymphatics, it stays put and it holds on to a bit of moisture, not much, mainly that's hyaluronic acid. And it's not actually going anywhere, but it's helping your skin have some structure to it. Now, if hyaluronic acid is similar, as in it's sitting as an extracellular, part of the extracellular matrix, it's holding on to moisture, and it lives there, it's not going to cause a problem. The question is, are fragments of this getting into the lymphatic system and blocking it? Now, this is actually, I know this is a possibility, because if you destroy the gene that makes hyaluronidase in a mouse, they basically get puffy because their lymphatic system doesn't work across their whole body. The question is, that's the whole body though, of course. Mm-hmm. So what's actually happening with the filler that we inject, and how hard is it to get rid of? Now, if a small fragment of hyaluronic acid breaks off, it will float off, and it will, like a natural piece of hyaluronic acid in your body, it will go down into your lymphatics and get digested and distributed. Are we dealing with intermediate fragments that are actually blocking the lymphatics, or is this nothing to do with the blockage of the lymphatics and simply that it's holding onto moisture within the tissue, which we know hyaluronic acid does anyway? So if you inject a dye into a tissue that has got a molecule that holds onto moisture in that tissue, and we don't even know how this dye interacts with hyaluronic acid. You literally could just be looking at a dye that's in hyaluronic acid. It's not actually testing lymphatic drainage. There's still lymphatic drainage happening, but the dye is not draining because it's interacting with hyaluronic acid. That's different to blocked lymphatic channels. And the second thing is, if it blocks them locally, does that really make any difference? Because blocking them locally, I tell you where it would make a potential I don't even know if it makes a big difference there. But basically, if you had an infection locally in your skin, are you going to be able to clean that out? But mostly what happens with your lymphatics is they drain stuff, but they form these big filters, your lymph nodes, that stop it going into your system. So they're not designed to like pass it through anyway. So you just end up in a situation where you have white blood cells that are able to get there and attack the infection because they come through the bloodstream anyway. And then some of that debris won't be cleared away as quickly. But is that a systemic risk? I think probably not. I don't think it would be. I think if they were 100% blocked, you'd know very well because your face would become very puffy, and those patients need treatment anyway. I don't think they're super common. Like, certainly maybe it's the fillers that I use, I don't know, but I don't see my patients coming back with more filler, like more volume over time, routinely. You get a small cohort who do that, and I think it's filler specific. I think some fillers are worse than others. But I don't think it's normal. I don't think everyone is like that.
Yeah. Okay. So that's your point of view. This doctor, has gone to the extreme of saying he's not going to do fillers anymore because of the results of this study that he's undertaken.
Yeah. So a lot of people draw a line with risk in this kind of way that makes it sound like they've reached some first principle absolute truth of the universe. But really, everything is a pros and cons. What's he going to do instead of filler? Because I want to know exactly what the outcome is for that. Because if it's surgery, a high number of your patients are miserable after surgery. It's much higher than dermal filler. So is he really doing anyone a favor? Obviously, he's also a surgeon, which means it's great for him to kind of own the hardest, most high-risk area and to disregard the thing that everyone talks about all day that solves their problems for much less money. So there's definitely an element of like, well, you would say that. I mean, surgeons always do this. It's like it's one of the most common tropes in aesthetic medicine is the surgeon hating on non-surgical techniques. It's so old and so predictable that it's like, it's not that interesting on its own. I'd like to know more about it, the exact reasoning and what's he going to do instead and whether that's actually safer. Because I don't think he's said what he's going to do instead. Because obviously the safest thing is to do nothing, but then no one gets the benefit either.
Yeah. Well, there's a comment here from Dr. Patrick Treacy in which he said, while dermal fillers may block lymphatics in localized areas, they do not pose systemic threats to the overall immune system. Is that kind of what the vibe you're thinking as well? Yeah,
I think it's super local. Even if they were blocked, it would be local, and it's not really your immune system. I mean, it's part of your immune system, but you're still going to have white blood cells able to get there and attack and solve the problem of an infection. It just will maybe less effective, so maybe it goes on a bit longer, but it's not like you've destroyed your immune system because you've got
It's not ideal though, is it?
None of this is ideal. I mean, it's a choice. There is no intervention that doesn't have risk. So,
but do you think that's likely to happen? Do you think that does happen?
I think some people get puffy faces after treatments. For me, that's the risk. I think it ends at that. I don't think there's a higher rate. I mean, this what they've done in this article is they randomly throw in breast cancer with a type of breast implant that caused inflammation and caused breast tissue to become cancerous slightly more commonly. But we're not having a spate of cheek cancers. It's not. It's they've just thrown it in as let's put the word cancer into the same article. That's really about puffy faces, and puffy faces are not routine in a good clinic with the right product. I mean, that's been my experience. You do have a cohort who need to be reversed every 5 years or so, but they're not the standard outcome.
Yeah. So let's break it down. Like you said there's different, I guess, words that have been mentioned. So cancer, immune response, lymphatic blockage and drainage. Can we break down the differences in this article and this study and why it's referencing each of those? So let's start with the immune response. That caught my eye as a patient because when I actually was ill with the virus, the next day I woke up and my filler where I'd had filler, so temples, cheeks, chin, hurt, was swollen, and wasn't puffy, but it was red. So this article, then that made me think, oh God, that happened to me. Something happened in my lymphatic drainage. I had some sort of blockage and it triggered an immune response to attack the filler. So, but you're saying that's different. That's a different aspect in this article.
Yeah, so delayed onset nodules, If your immune system has increased activity, then it might basically reacts to other things. That's true with your joints as well. So when you get flu, you get an achy back. Your joint, some people's they swell up, like you can see the inflammation on them. So inflammation is a thing, and it is revealed by filler. Filler also becomes inflamed. It's more so with fillers that have short chain hyaluronic acid than long chain. Long chain is actually anti-inflammatory. Short chain is inflammatory. So the product that you have has a mixture of long and short chain, and it makes it great in lots of ways. It's good at aspirating. It's better at not causing the puffiness. And that's been not just a statement from the drug company. That's my experience as well. A big difference compared with other fillers. But if you have a lot of inflammation in your system, it could cause some of that inflammation to happen around the filler. And like what happens to you, if you do nothing, normally it goes away. That's got nothing to do with immune.
Okay,
drain,
I guess that's the point I was trying to get to.
Yeah.
Okay, so that they're making one point, because that is presumably about the killer T cells trying to combat foreign objects when the immune system's over-triggered, right?
Yeah.
Yeah, okay, so that's the one claim, but then there's the other claim about the lymphatic drainage, so you're saying these are two different things.
They are two different things.
Okay.
And similarly with the way they're throwing cancer in because of the breast implants, there's just a third thing they've thrown in. They're not linked at all in the article. Maybe there is some new way they'll find a way of linking it, but currently it's basically like let's talk about all the scary stuff together: infection, cancer, immune damage, blocked lymphatics. Whereas the reality, from what I can see, is the real risk to patients is puffiness. It's overtreatment syndrome. It's that mid face that looks too puffy because they've had treatment that's expanded over time, which is a thing for a minority, but I don't think it's the standard experience.
So for clinicians watching this, what would be a key thing for them to take away? What's the key learning from this?
So I think we really should pay attention to these types of things. I do have a fear in me that we'll find out that something you've been injecting for many years turns out to be really bad. But you've got to interpret the stuff that happens through, what actually happens a lot in the world, which is stuff that gets attention gets disproportionately amplified. Stuff that's scary is disproportionately amplified. And then make a decision in the context of what is the benefit to patients. There are countless patients I know who've had a treatment and it's been a turning point in their life and they're much happier and, they get all that benefit. And then, yes, maybe a cohort of those every 10 years look a bit over-treated and you have to talk about reversal or not treating them again. But there isn't an alternative. It's not like you can just do surgery and have a happy world where no one gets hurt, or not do anything and end up with people just accepting getting old gracefully. Unfortunately, it's messy. There is no clear path, and a good clinician helps the patients make good decisions in the context of their life and balances those risks and talks about them openly. So I think it's great to have a conversation about it and to weigh it up and to be informed on it, but not to be like, there's a doctor who's never doing filler again. That means I should never do filler again. And same for everything else, because I can tell you the same thing true of vitamin E also causes lung cancer in certain patients. So we're all going to scrap vitamins? Probably not. There's other supplements that cause different things. Exercise can end up in injuries, like going to work can be dangerous. Basically all the normal stuff you do in your life has a potential downside, and it's better to interpret it as a weighing up of risks than a black and white, like this guy is trying to make a black and white case for using filler. Yeah.
What role do you think clinicians play when stuff like this comes out in educating patients about this sort of stuff? Because if I was a patient and I came across this would be something where I thought, it probably would make me think twice. This article did get me. It got me.
Yeah, so I think the best thing to do is to try and explain it rather than take a strong position on it. That's what I would do more often than not, is instead of being like a lot of people are like, oh my God, we've just discovered filler lasts for 12 years. This is everyone, instead of that, which is great, you'll get a lot of clicks and people pay attention, is try and explain it from both sides, because the truth is it doesn't matter what the cons are, because you still have the problem, which is a con in itself. So like, as in, I'm miserable, I'm getting older, I'm single again, I'm 48, and I want to go dating, and I don't want to have surgery. What are you going to do for me? Like, that problem is just as real as puffiness being an outcome of some procedures. So be the one who's like, right, yes, there are risks, let's admit to them, but there are benefits too, and I will help patients make the best balance of risks. That doesn't mean you should never have filler. Maybe there are different types of filler. Maybe there are products you can use that don't have the same problems for patients who've had a bad experience in the past. But it just becomes one of the many things that you help patients make decisions over, rather than like throw the baby out with the bathwater, basically.
Is there any differentiation between like hyaluronic fillers versus non-reversible fillers in the lymphatic drainage issue?
Yeah, there will be differences. So calcium hydroxyapatite almost certainly will not drain in the same way as hyaluronic acid, and some of them also trigger collagen production. So what you're actually doing is triggering collagen. So an example would be Sculptra. So you're causing a foreign body reaction. That means it's involved. The immune system's involved with this. So you're triggering. There's a different mechanism. So you're triggering fibroblasts to respond as if there's an injury going on, so that they produce collagen, and that collagen is not going to block your lymphatics. So it's better in some ways, but you can also get lumps and bumps and nodules that arise years. The scary thing for me is they can happen years afterwards. And so you've forgotten you even had Sculptra, and the next thing you've got all these lumps on your temple and your cheek, which I've seen a patient with. And there's ways to avoid that, and every clinician who loves Sculptra will immediately be saying, well, that doesn't happen if you do X, Y, and Z. But it's on the list. And so one day there'll be an article of the filler that causes nodules to pop up decades afterwards, and everyone will be terrified and they'll be stopping. But the nuance is it's a minority of people. Most people it gets better, or even if it doesn't get better, it's mild. And it's also helping thousands of other people in the meantime. So that's the complexity of medical decision making. It's never, if it was black and white, easy, like perfectly safe or not perfectly safe, you wouldn't need a clinician at all. It would just be like, well, let's all just do it. There's no risk. So in summary, when you get new information like this, I think it's worth trying to find the source article and get to the heart of what the science is. Now, this paper isn't even published yet, which is another big downside. So we don't actually know for sure what this test was, whether it's a good test of lymphatic drainage or simply of how well hyaluronic acid holds on to the moisture that's in your skin anyway. So we don't actually have the answers of what's going on. So find the source material and then remember to interpret it within the context of both the pros and the cons, because there's always something good about what we do and something bad. And we're trying to balance the risks against the risk of doing nothing, which is a relatively sad and painful thing for many people if they cannot maintain their appearance. So I hope that helps you with your patients, and don't be afraid of talking about it. The best clinicians will talk about any topic. They never fob a patient off. They just know more than the patient, even if it's just a little bit. Hope that helps you. See you next time.